All right, so I wanted to recap all of that anatomy stuff we talked about on day 1 and what we talked about in our follow-up visit. So what I want you to pay attention to is first we're just going to look at the layers of muscle again. And I want you just to see how many there are. So when someone says, oh, it's just a soleus strain or overuse, why I tend to look at a little bigger picture and a little bit more options, especially when you mention things like stinging and a little bit of a different pattern of pain than just where soleus is. So let's start with the really deep muscles here. So this is your posterior tibialis muscle. When we're talking about flat feet and we're talking about foot control, posterior tib is basically the built-in arch support. Let me get back to clicking on that. So you see how it starts way high up, it comes down, and then it comes into your actual arch. Let's zoom pretty far in. So when I'm having you do your arch raises, you're activating this muscle to help lift your arch and support it. Okay? So other things to think about while we're on the deepest layer are the bottom of your feet. So you have all these little tiny muscles that need to be able to fire efficiently to stabilize. So these are not necessarily the ones that I make you do when you toe scrunch. I'll show you that here in a second, but I just wanted you to be aware of the layers. So when we add on more layers to the back, these are when I'm making you do your band exercises and your foot's going out. That is your peroneal muscles. You don't have to remember the name of any of these. Now we start adding on. So this is your flexor digitorum. So it flexes your toes. So if we spin move and look at the bottom of the foot, where this guy comes down and he goes to all of your toes, except for the big toe, that one has its own. When I have you do toe scrunches or things like making sure you're pushing all the way through the tip of your toes, when you're doing your seated calf raises, I am working on this muscle. This is the one that goes to your big toe. Okay, so anytime I have you focusing on pushing through big toe, second toe, I really want to make sure that this muscle has a nice amount of endurance. So that's why I set you on a timer, and making sure that you're able to push through your big toe, because that's your explosive pushing off your toes into power. And when you're pivoting side to side in tennis, we need to be able to have the control of the big toe when you don't have control of the big toe. So let's talk about things that happen. So when you can't control through big toe and you roll out towards the side, you end up putting a little different pressure through the foot, and you actually end up pushing off differently. So when you aren't able to actually push through the big toe, arch also starts to collapse a little bit, and you do have a little bit of flat feet, which is normal, super typical. Let's go back to the back here. And these are all those really deep layers that when I am tapping on your bone, I'm going through these layers that I can't get to from the surface. All right, now we get into your soleus muscle. So the soleus muscle, it does move your ankle up and down. So let's actually just show you. So it does a calf raising motion, right? But if you see, it sits deep to this gastroc and it does not actually cross the knee joint. So calf raising motion, we got to be able to have endurance in that muscle. And then you can also see all these other tendons for the ones that go into your toes. So just to remind you why we do the things that we're doing. Okay, so now let's take a peek at your gastroc, your main calf muscle everybody thinks about. So the gastroc muscle, it does the same thing we just looked at, but it also actually helps you bend your knee. So when I have you do your calf raises and your knee is bent, your knees are bent, it's to put a little bit of slack on this muscle so that all the work can go to your soleus muscle. Okay. Now, when you were having some of your discomfort, oh, and the other reason I like dry needling is you see this big white part we talked about? Anything that is white like that is a really thick type of material. So we can foam roll, I can push on this, but it's really hard to actually affect the true muscle tissue underneath that. So needles are excellent because I can put them in and it goes straight through this tissue and gets to everything underneath. All right, let's talk a little bit about the nerves. So when we start adding in nerves, We'll zoom in here. Whenever I needle, I am trying to affect the muscle, I'm also trying to affect the nerve. So I will come in and I get near these branches over here, so I normally put a needle right here on you, normally put one right here on you, and I put one right here in the middle. Let me see if I can zoom in enough to click on it. So your sural nerve, so when I have that one right there in the middle, I'm trying to affect your sural nerve. When the sural nerve gets irritated, you can get some of this kind of burning, uncomfortable sensation that comes down and actually goes towards the outside of your ankle and can get into your pinky toe. You're not getting any of that, but I just wanted you to be aware. Let's add on. Okay, so that's all the ones we're looking at, but let's actually go a little deeper underneath the muscles now. So if you are seeing this guy here, all right, that is your tibial nerve. So anytime you talk like stinging or this really just tension feeling that stays tight for no reason really, a lot of times it's tibial nerve. So it wraps all the way around in here. The other reason I like to needle is, again, I can get deeper. So I'll try to move it over. And I can affect these deeper nerves. So I also come up here and I needle you by your popliteal muscle, which is this, and I get real close to this nerve. Okay, so I just wanted to give you an overview of what all we are taking into account of. Now real quick, let's zoom out and I want to show you lines of force. So when I'm talking about having stable hips so that your knee is stable and so that all the force that travels down. So if I put, we're talking line of pull here, right? So if you're doing a squat and your knee starts to angle in, I usually cue you to push your knees out, but when I don't, if knees start to angle in, that puts a little bit more force through here and your arch tends to drop more, okay? So if we are looking at how I want you to do and actually start pushing the knee out a little bit so that your knee tracks nice and in line with second toe, it helps keep that arch lifted a little bit, gives you a much more stable foot to push off of. Think of your foot like a springboard. Okay, if it's floppy and jello-like down here, the other muscles are going to have to take up for the slack of that. So the more you can really get a direct line of push through your foot, more power you're going to have, better efficiency you're going to have pushing off your feet in tennis. Oops, didn't mean to draw on there. So hopefully that gives you a little overview on why we're doing what we're doing. Everything is connected, so we've got to be able to, let me stick your other layer of muscle on here. We got to be able to recruit your big muscles, okay? So like glutes, hamstrings, quads, so that you have support going through the knees, so that you have support traveling all the way down the chain.